Hey there, Fourth Trimester listeners. Our program today is proudly sponsored by Family Album, your secure haven for sharing baby photos and videos. Head over to the App Store today, search Family Album, one word, download the app, and start creating a legacy of love, one photo at a time. Hi, I'm Sarah Trott, and welcome to the Fourth Trimester Podcast. I'm a new mama, and this podcast is all about postpartum care for the first few months following birth, the time period also known as the fourth trimester. My postpartum doula, Esther Gallagher, is my co-host. She's a mother, grandmother, perinatal educator, birth and postpartum care provider. Fourth trimester care, our topic, is about the practical, emotional, and social support parents and baby require. And importantly, it helps set the tone for the continuing journey of parenting. Hi, this is Sarah Trott. Welcome back to the Fourth Trimester Podcast. I'm here with a special guest, Megan Ellow. Esther is not here with us today. She is handling a postpartum client, and we are so grateful for the work that she does, and we will miss her today. And before I introduce Megan, I want to remind everyone that we have a website, which is fourthtrimesterpodcast.com. We have resources. We have recordings of all of our episodes there. Please also log into iTunes if you're a listener there, or Google Play, and hit subscribe so that you can be notified every time we publish a new episode. Also on our website, you can sign up for our newsletter where you can receive updates from us via email in your inbox whenever we release a new show. So I am excited about today's topic because I've been wanting to have this conversation for months, and Megan reached out to us. And we're so happy that she did. We're going to be talking about the topic of postpartum OCD. So postpartum OCD is a thing. It wasn't something I was aware of until I started researching and getting into the space and having conversations with people who had experienced this firsthand. So I'm really excited to talk more about that and demystify the subject in general. Megan herself is a licensed clinical social worker in the state of Delaware. And she's been working in the field of mental health for 9 years, working with children, teens, adults, and families. Her passion is working with women struggling with mental health concerns surrounding pregnancy, postpartum, and parenting. She has a small private practice called Nest Counseling and Wellness in Wilmington, Delaware, where she focuses on perinatal mood and anxiety disorders. She's a member and volunteer with Postpartum Support International. Yay! We love PSI. And she is a survivor of postpartum depression and postpartum OCD herself. She lives outside Philadelphia with her husband, her 7-year-old stepson, and her 4-year-old daughter. So welcome, Megan.
Thank you. Thank you so much for having me on today. I'm really excited.
Yeah, I'm so thrilled. You were saying you listen to our show on your commute. Thank you so much also for being a listener.
Yeah, absolutely. I'm a little bit of like a kind of birth and pregnancy junkie. So I listen to all the podcasts about that kind of topic because I just can never get old for me.
There's always something new.
Absolutely.
Everyone's experience is unique, and we obviously love the topic as well. And since you're a mom, we were wondering if you would share your own fourth trimester experience with us.
Yeah, absolutely. So when I got pregnant with my daughter, I was finishing up graduate school. I was finishing my master's in social work. And I had, the genius idea to get pregnant during my last year of graduate school. And then I would, have my daughter and be, take a maternity leave. And then I'd, go on to the next step in life. And I thought, oh, yeah, that sounds like perfect timing. And obviously, that was a horrible idea. So I had a really, really rough pregnancy. I actually had hyperemesis. So I was really, really sick all the time. And I was working as a therapist, counselor, and finishing up graduate school, which is challenging, of course. And so I was really, really busy all the time on top of being really, really sick. And just dealing with all the pregnancy stuff and appointments and, aches and pains and things like that. So it was just very go, go, go during my pregnancy, thinking like, once I have her, like that will be kind of my rest. And I had my daughter in April of 2014. And it was really hard at first. I was very, very anxious. And I'm not really much of an anxious person in general. But I was terrified all the time. And so, what started off with what I thought was kind of normal mom worries. And a lot of people were reassuring me of that. Every mom worries about, their baby, not breathing. And every mom checks on their baby to make sure that they're breathing. And every mom has concerns that they might drop their baby. And so I thought, well, this is normal. And it wasn't until, it got worse and worse that I sought treatment a couple months later and really started this journey of discovering that what I had was postpartum OCD. Because what I had was not normal worries. I was having these intrusive thoughts about things happening to my daughter. And it wasn't just a scary thought that would come and go. It was all the time. And it was really frightening to me. It was like a horror movie that just wouldn't stop. And I think a lot of women experience it like that. Like it's a really, really scary movie that you just can't turn off. And so I would have thoughts of dropping my baby down the stairs. I would have thoughts that she would get hit by a car when we were crossing the street. I would have thoughts a lot of times of her not breathing. And so I wasn't getting much sleep because I was up all night, every night, checking on her. And so after my maternity leave, I got a wonderful job, but I was working as a therapist for kids in the foster care system. And specifically, I was doing trauma therapy with them. So kind of some of the therapy that I was doing involved them saying their trauma narrative. So I would hear the details of the stories that these kids experienced. And kind of that combined with my anxiety, it got really bad. And so I would go home and I'd have these nightmares of these things that I heard during the day in my work as a trauma therapist. But I would experience them like it was happening to my daughter. And so I'm sure you can imagine how terrifying that was.
Oh, yeah.
And so it was just all the time, like a hypervigilance, always like being jumpy that something was wrong. I had a really hard time leaving her. I left her for work and had to leave her for work, but I wouldn't leave her for anything else. I wouldn't go to the grocery store without her. I would never get a babysitter. And so that became difficult. Luckily, I found a really, really excellent therapist who worked with me, and we did a lot of mindfulness stuff and, worked on like yoga and things like that really helped kind of center me and calm me down. And slowly but surely I got better and got, more into the zone as a mom, and my relationship with my husband and my stepson improved. And, eventually a couple years later, when I was truly well, I was able to kind of get back and get involved with Postpartum Support International. And now I'm a helpline volunteer for PSI, which I just love doing. And I hear all the time from moms that have kind of a similar thing where these moms, they have these terrifying, scary thoughts and they don't want to tell anybody. And they finally speak it to us. And I'm able to normalize it and tell them, yeah, I know that's postpartum OCD potentially. And I get it, and it's normal and it's common, and it's also really, really treatable. And I think there's a lot of people that just don't understand postpartum OCD. So I'm really glad to be here kind of talking about it, but that's just a little bit of me and my story and, my healing from postpartum OCD.
You really went through a lot. What was it that you said was making you sick during your pregnancy?
I had hyperemesis gravidarum, and I might not be saying that right, but HG. And so I was really, really sick all the time. I was nauseous and throwing up constantly, and it was horrible. Yeah.
Oh, man. So that was just something that developed through your pregnancy.
Right.
Genetically, not a disease, not
right.
an illness. It's just happened.
Yeah.
Okay. So that was hard.
Yeah, absolutely.
Your pregnancy was tough. You're also listening to children share their traumas. I certainly know myself well enough to know I personally couldn't do that day to day. I think I think that would affect me too. Like, I'm trying to give you a compliment. I'm very impressed that you can do that work because it's extremely important.
Yeah.
And those children are extremely lucky to have you to help support them. So thank you. I am very impressed that you could do that anyway, but just on top of being sick and on top of, having your own baby at home that you're worried about, I just can't imagine how that compounded in your mind of, worrying thoughts. I for sure thought all kinds of disaster things were going to happen to my child. Normally it would come and go when it was a first, like the first time I had to go back to work or and someone else was looking after my baby. It's one of those things that it's, I think it's hard to draw that line and say, well, okay, that was one intrusive thought, but I like how you were differentiating between an occasional worry versus all the time.
Yeah.
All the time.
Yeah. And it's like I said, it's really common. I think every mom has these thoughts and dad have these thoughts. But when it's getting in the way of your functioning, that's when it starts to be a problem. And it was getting in the way of my sleep, my well-being, my relationship with, like I said, my husband, my stepson, and my friends. It was getting in the way of my work. So it was kind of impacting my whole life. And I think that's where the differentiation is between, just normal mom worries and postpartum anxiety or postpartum OCD.
Yeah. And you said this is common. How common is it?
So there's not a ton of research, but from what we can tell, some of the research that's been done, we're thinking it's around 11% of new moms that have this postpartum OCD. And then moms that have pre-existing OCD, a lot of times they'll see a reoccurrence in the postpartum period. That's really, really common. But yet, from what I've read, it's about 11% of new moms, which is, kind of a lot.
Yeah. Oh, yeah. That is 1 in 10. A little over 1 in 10. I mean, that's very common. And you said so if someone already has anxiety or already has OCD, that this is something that could intensify those situations. Yeah,
absolutely. I think it's really common for women that already have any kind of pre-existing mental health issue. It's fairly likely that they're going to have kind of a recurrence of symptoms or a worsening of symptoms in the postpartum period because of all the things that go on in the postpartum period, the hormones and the changes in the relationship and lack of sleep and all of that stuff. So it kind of makes sense that it's going to make it worse. If you already have something, same with depression, women that already have had depression, they're more at risk to have postpartum depression. And so it's the same. And so in some ways, that's good that we know that. So women that have had some kind of pre-existing mental health issue or pre-existing OCD, they can maybe be a little bit more prepared to kind of get their supports in place. And I encourage all women that I work with that are pregnant that, to go through their history and try to figure out if they're at risk for this afterwards. I know for me, it kind of came out of the blue. Like I said, I'm not an anxious person. I've never been diagnosed with OCD or any anxiety disorder. And so it really came out of the blue for me. And that was part of what was kind of really scary for me. I just didn't know what was happening, even as a therapist. Although I hear that a lot from other therapists that they didn't know what was happening, even though they're kind of trained in this. But I guess, we all get our blind spots.
Huh. Yeah. Right. I mean, this is meant to be an area of expertise, and yet there you go. You don't know.
Yeah.
But isn't that the way? We've had a number of people come on the show and talk about postpartum depression specifically. And it's very hard when you're in that kind of state from what they've described to recognize your own symptoms, to stop and question what's happening. Part of the depression, my understanding is that it's hard to reach out for help. It's hard to help yourself. You're so stuck in a rut in your own feelings in your own head that understanding what's even happening and having that awareness is really tough.
Yeah, absolutely. Well, because that's also part of what, mental health does to us. If we have depression or anxiety, it kind of distorts our thinking. And so for me, along with the OCD, I had depression as well. And so I had kind of a lower, self-esteem. And, my depression kind of told me that, things were never going to get better. And this is just how they were. And nobody can help you. And so that's kind of what mental health issues do to us, is it distorts our thinking. And so we're not necessarily always thinking logically or rationally, because we're stuck in this kind of emotion mind. And so that's one of the biggest barriers to people getting help. And there's a lot of barriers. So this is tough stuff.
And of course, there's also the way the healthcare system is set up in the US, and the way we have, families living all over the country and not necessarily in the same town supporting one another. You have women with the mentality that, all right, I had my baby, I don't have my checkup for weeks and weeks and weeks away. I've just got to survive this on my own. And I'm going to be tough, and I'm going to smile and entertain people, and, all of these things that are not oriented around helping mom and baby, not necessarily. Moms aren't getting their 40 days of rest. They're not, our culture doesn't support some of the traditions that we see around the world. Our culture isn't really supporting women to take the time that they need and get the help that they need from their community. So it's like, all right, so you're already set up to fail, and that even if you didn't have depression or OCD or anything, it's like you just have to survive.
Yeah.
There was a guest on the show who said like, I'm just a pioneer woman. I have to just survive through this. And it's like, no, you don't. You can put a lot of things in place to help you get the support you need. Have friends bring you meals, have people help you clean your house. You don't have to do everything. Your job after you have a baby is to heal your body, get the rest that you need, and have that bonding time with your baby. And take care of yourself. So, this mentality of having to survive on top of maybe feeling anxiety, OCD, depression. Oh, what a recipe for pain for a lot of people.
Yeah.
So, that's really hard.
It is. And I think that it's hard for women to ask, I think all people, but I think especially for women, it's really hard for us to ask for help, because I think we're so conditioned to be the caretakers, right? Like, we take care of the kids, and, we help, our family, and we do all of these caretaking things. So we're so conditioned to be the ones taking care of other people. It's so hard for us to drop that and to ask for help. And I know I had that experience. I didn't ask anyone for help. Luckily, I had a couple of people, especially my mom, who was just a blessing to me, who I didn't have to ask. She just came over and she brought food again and again and again. She came over and she washed the dishes and cleaned my house and, talked with me when I was crying. And, I didn't have to ask her. But I know a lot of people don't have even that. And so it's hard. And I didn't know how to ask for help. I had never needed help like I needed help in the postpartum period. I've never had any health problems, and I've just always been able to do stuff on my own, and been proud of that. And so it was hard for me to need help from other people. And I hear that a lot with women, that they don't know how to ask for help. And so, I always encourage moms to, I heard at a training through PSI, they talked about the seasons of giving and the seasons of receiving, and that we all go through the seasons of needing more help and the seasons of giving more help. And that when you have a baby, you're in the season of needing to receive help. That's just the way it is for everybody, and that we should be okay with that. And we as a society should really put that message out there. New moms need help. Even if they don't ask, they need help. So go help them. Yeah,
I was just in the grocery store today, and my daughter, I have a toddler now, but my daughter was kind of tired and hungry, and I was trying to give her some grapes and snacks and things, but she wasn't really particularly pleased to be at the shop. And the woman from the cheese counter came out from behind the counter and said, "Hey, let me help you rearrange some things in your basket." And she gave my daughter some cheese samples and kind of talked to her. And I just thought, wow, that was incredible. Like that act of kindness was so like in the moment, I was just like, oh, wonderful. Great. Yeah. Give her some cheese.
Yeah.
But I reflected on that and I was just like, that was incredible. And just these little things, these micro kindnesses that we can do for each other. It doesn't have to be a stranger, your friends or whomever, but it's really meaningful.
Yeah.
It's so nice.
Yeah, absolutely.
Hey, fellow parents, can we take a moment to reflect on the joyous chaos that is parenthood? You know those days when our hearts swell with love at the sight of our little ones and we're bursting at the seams to share every adorable moment with the world. But let's be real. Some things are better kept in the family, and your loved ones who matter the most aren't always close by, and they might not be that tech-savvy either. So how can you easily share your baby's beautiful growth with loved ones while keeping your precious memories secure? I remember the frustration of trying to use some of the big tech photo solutions, only to find they fell short of what I needed. That's when I stumbled upon something truly remarkable, the Family Album app. The Family Album app was created to give parents a secure and easy way to share photos and videos with loved ones. It's an orderly and totally secure haven for your family's personal memories. I love that there's no third-party ads, no unwanted eyes, unlimited storage, and that it's totally free. So to all the parents who are out there still trying to use other messaging apps for your kids' photos, it's time to level up your family photo game with a free photo sharing app. Head over to the App Store today, search Family Album, one word, download the app, and start creating a legacy of love one photo at a time.
So you also said OCD is very treatable. Let's talk about that part. So let's say someone understands that they have postpartum anxiety, postpartum OCD specifically. What does treatment look like?
So, being a therapist, I always say therapy is great. Let's go to therapy. And therapy can really, there's a lot of therapies that are proven really effective for this kind of thing, including cognitive behavioral therapy and some kind of exposure therapy. But the important thing is to find a provider who's trained. And so that's where I think PSI does a really great job of helping connect women to trained providers, because it is a specialty. And so if you can find a therapist who's trained specifically in perinatal mood and anxiety disorders and can do this kind of work, I think that's probably the key. And so I think therapy is really great, especially because, medications can come with all kinds of side effects, but, therapy is pretty low risk. It's usually pretty helpful. But on the other side, I think that there are a lot of medications that are really, really helpful. And that there's a lot of stigma around mental health medications. And I think that gets in the way of a lot of women getting the help that they need. And so I encourage all moms, you can go talk to a doctor. That's okay. It's okay to need a medication because your brain chemistry is a little haywire right now. And it doesn't mean you have to take it forever. But let's get you some help because there's no reason to be suffering. And there's lots of adjunct therapies. I think with any kind of postpartum mental health issue, social support is really, really key. And so a lot of the work that I do with moms is helping them build that village however they can. So reaching out to family and friends and getting them to come, like I said, do your dishes or bring you food or just hang out with you. There's support groups for moms kind of all over the country, for perinatal mood and anxiety disorders. And they're really great. A lot of hospitals run them. But even just a regular mom group, if you can find other moms that you can connect with and that you can commiserate with and laugh with, and that can help you with practical things when you need it, I think that's really, really important. So, therapy, medication if needed, and then I think social support, those three things together are really, really key to getting mom well. And when we're talking about moms, we're talking about families. So I think it's important always to bring dad or partner into the mix with treatment, mom, mother-in-law, best friend, whoever, because this isn't something's wrong with mom. This is a family issue. And so I think it's really important to do family therapy and to bring the family into the treatment and have them be a part of the treatment team. So I think the first step is getting connected with somebody, which again, I'm going to throw a bunch of plugs out there for PSI because I just love them. But any mom, dad, caregiver, anybody can call the helpline and start getting connected with some of those services. So.
Right. And that phone number is free.
Mm-hmm.
And that phone number, I understand, is also available in
Yes.
Spanish. So, just encourage friends to use that and families to check it out. It's the kind of thing to have on your fridge before you have the baby. Do your research beforehand, we always say. And, any time is great. But, before you have the baby, you tend to have a tiny bit more time on your hands. And a tiny bit more energy. So
I always,
so lining that up.
Yeah. I always like
good.
Moms to have, I tell them, like, if you can get them when they're pregnant, have the numbers ready. Like I did that with, having a couple lactation consultants ready, because I was planning to breastfeed and did. But I was, a little nervous about it. And I was like, luckily I did some research, some lactation consultants near me, and I had them ready. And I think Mom should do that with everything. Have the lactation consultant numbers, have some postpartum doulas, ready, stand by, have the helpline number. And you'll be kind of ready to go and do like this kind of pregnancy plan. And you'll be in a much better place, because it's hard, like I said, when you're in that place where you're struggling, to reach out for help. I mean, it's hard enough just to try to find a phone number. So.
Yeah, completely. It's so much tougher to try to do the research when you any 10 minutes you have free. Man, you want
exactly.
to sleep. It's like you're not going to be on the computer.
Yeah, absolutely.
Yeah. Well, I love your thoughts there. So the three things, social support and therapy and medication support, if that's what's needed.
Yeah, absolutely.
That you said.
And there's lots of like adjunct things that you can do that can be really helpful. Like I said, when I was doing therapy, mindfulness and yoga was really important to me. And so there's all kinds of like alternative holistic therapies that people can do. I know there's a lot of research with acupuncture. And so whatever Mom wants to do, like I support. And I know a lot of moms have different ideas about what's best for them. And I just think, Mom knows what's best for her. And I'm just here to be a mirror and kind of help her figure out what's best for her. So.
And you're talking about the body chemistry, the brain chemistry, and the hormones of being pregnant and having a baby. All of this stuff is in flux, which can trigger, even if someone hasn't even had any anxiety or OCD previously, those things can trigger that mental health issue. And some of the questions I have are like, is that right? Like, what is the trigger? And then also, presumably after the hormones are sort of rebalanced a period of time after the baby is born, would someone who has postnatal OCD, would that continue for the rest of their lives? Does it disappear? Like what?
Yeah.
happens?
So, again, there's not a ton of research being done specifically on, that has been done on postpartum OCD. But for a lot of perinatal mood and anxiety disorders, we find that it really is just around the postpartum period. And so women that have like postpartum depression or postpartum anxiety or anything like that, usually if it's treated and you get good treatment, it doesn't necessarily come up again. For some women, it does. For me, I haven't had any new experiences of symptoms since I had my daughter, and she's 4.5 now. And I don't think that I will, but I'm also ready for it. Like if something were to happen again. So now I know kind of the signs and symptoms. And so that's kind of what I talk with moms when they are at the end of treatment and they're feeling a lot better about doing like a safety plan. So if these kind of symptoms come up again, what will we do? Who will we call? How can my partner look out for the signs and symptoms if something's happening again? And so I think it's really important to just be ready. Like it could definitely happen again. Obviously, if you have more children, that, could definitely happen again. But, with women, our hormones are always changing. And so there's a lot of research being done on menopause and how that affects like our mental health. And so even just thinking, obviously, if you're having a baby, that menopause maybe is potentially kind of far away, but just something to kind of be aware of and have in the back of your head that these are the potential times when things could pop up, but just being ready for them and having the kind of safety plan of what you're going to do if these symptoms do come up again. What
time period are you referring to as the postpartum period?
So when I say postpartum period, I usually mean the first year, only because that's kind of the marker for a lot of the mental health issues is that in the DSM, the diagnostics criteria is within the first year after having a baby. So that's what I refer to it as. But I know a lot of people, it's kind of it's a fluid thing, I think, postpartum, because I mean, even at a year, I think like for me, I felt postpartum for longer than that, honestly. Yeah.
Oh, yeah.
And I mean, I was breastfeeding past then and not sleeping very well past then. So I still very much felt like I had a very young child and that I was early postpartum, even at, a year and a half, 2 years.
I know. Why can we not give women their first year off of work? I really don't know. If I could change, well, I wouldn't say one thing. If I could change 10 things, that would probably be right
me
up there.
Me too. Absolutely. I think that's one of the worst things, is that, so many women are forced to go back to work. And I mean, I'm a working mom and I love working and the work that I do. But I think we know that it's better for moms and babies for them to be able to make that choice. And we don't let moms make that choice. And I think that's such a shame.
We don't. And the expectations that we have on women and on babies in terms of I mean, children are resilient, right? They are, and by design, and that's a really good thing. But my goodness, they sure want to be with their mom. Yeah. They sure want to be. They sure want to have that closeness. Well, what else?
So I talked a little bit about the kind of intrusive thoughts and the scary things that happen that moms think about, and then so for some moms it's kind of just the intrusive thoughts, but for a lot of moms that's kind of the compulsive behaviors, also the kind of C of OCD, and so for a lot of moms they not only have these scary thoughts, but they do some kind of behavior to make sure that these thoughts don't become a reality. So for a lot of moms, if say they have thoughts of maybe drowning the baby or the baby drowning, they'll avoid giving the baby a bath. And if they are afraid that they're going to drop the baby down the stairs, they won't go upstairs at all. And so these moms this is where it gets into kind of impairing functioning. These moms are doing all kinds of things to avoid the intrusive thoughts coming true. And that can really get in the way of mom's functioning, but also get in the way of taking care of baby properly. And so, a lot of moms have thoughts of, accidentally doing things to the baby. But some moms even have thoughts of them doing things to the baby on purpose. And that's where like a lot of the shame aspect comes in with this, because moms tend to think like they have these thoughts like, what if I stabbed the baby? And they're terrified by these thoughts. And they're like, what is happening? And a lot of times these moms think like, I'm going crazy. Like these are crazy thoughts. But really it's just postpartum OCD. And it's just like, loving your baby and the anxiety of all that in overdrive and gone a little bit wonky. And so I always tell the moms, you're not crazy. You're not going to act on these thoughts. And we can usually tell that because they're so upset by these thoughts. So a lot of moms get scared that, like I said, they've gone crazy or that they're going to act on these thoughts. But the way to kind of distinguish between postpartum OCD and something like postpartum psychosis. So a lot of moms, when they have these kind of scary thoughts, they think things like, oh gosh, I'm going to be Andrea Yates, who drowned her 5 kids. And, what's wrong with me? But there's a really big difference between postpartum OCD and postpartum psychosis. Women who have postpartum psychosis are out of touch with reality. They don't realize that what they're thinking is wrong, or out of touch with reality. And that's why they act on them, because they're not living in reality. But women who have postpartum OCD, they're terrified by these thoughts. They're really, really scared. They're what we call ego dystonic, which means they are not in line with our sense of self, and they're really, really unwanted. So it becomes like a really great sigh of relief for women to hear like that what they have is anxiety based and not based in delusion or psychosis, and that they're not crazy, and that they, just have this anxiety disorder and it's normal and common and treatable. So that's one of the biggest scary things that I think happen with women with OCD. So that's why it's really, really important for them to get the help that they need by a trained provider. And I think we have a lot of work to do on training not only mental health clinicians, but also medical providers. There was a story, maybe like 6 months ago now, where a mom went into her doctor's office and told them about some scary thoughts that she had. And instead of getting her the help that she needed and recognizing that what she had was anxiety, they called the cops on her. And I think that's what stops a lot of moms from getting help, is that they're really afraid that if they speak these thoughts, that they're going to have Child Protective Services called, or they're going to be, taken off to the psych ward. And so, of course, you're not going to, say those thoughts out loud because you're terrified that, your baby's going to be taken from you. And that's just not the case when you have somebody who knows what they're doing with this kind of stuff. And so we have a ton of work to do on training providers, medical providers on what this is. And so yeah, I hope that, that I can be a part of that work in the future because I think it's really, really important. And I always, have a heavy heart when I hear stories like that. And luckily that mom, they took her and somebody assessed her and recognized what she had. She got the help that she needed. But what a horrible, horrible situation.
Well, yeah, that's awful. I mean, it's hard enough to just be concerned that, your house isn't clean enough when someone comes over to see your baby for the first time, or whatever it is, which, by the way, for anyone who's listening, you can say no to people and say, I'm not going to have any guests until I'm ready. That's actually, think about that. Don't do it. Wait till you're ready. But yeah, I mean, we have these anxieties about just being performative and showcasing that we're strong and showcasing that we know what we're doing. It's not weakness to admit you need help. It's not weakness to confide in someone and to just make sure you're taking care of yourself. It's actually bravery to take care of yourself. It's bravery to reach out to someone and have that conversation. So please feel brave, everyone who's listening. Okay, so tell me anything else you'd like our audience to know about postpartum OCD.
So what I really hope moms and dads and families can kind of take away from this discussion on postpartum OCD is that it's a really common disorder, really, really treatable as long as you can find, the correct help to get. And so any mom who's out there that's experiencing these really, really scary thoughts, I just want you to know, you're not alone. You didn't do anything wrong and, there's help out there. So, find somebody that you trust and tell them, tell them what's going on with you and kind of speak this secret out and we can get you some help. So if any moms out there that are having this can call the warm line or the helpline for PSI and get some help.
So for listeners, the PSI helpline is 1-800-944-4773, 1-800-944-4773. It's free. You can dial an extension to get that in Spanish as well. And so I just want to take the opportunity, Megan, to thank you once again for being such a wonderful guest on our program.
Yeah, thanks so much for having me and for talking on this topic that's so, so important. And yeah, it was great. Thank you.
Yeah, thanks so much. All right. So everyone who's listening, please remember to go on to Fourth Trimester Podcast, sign up for our newsletter, go on Facebook, like our page, please. And we'll talk to you again soon. Bye-bye, everybody. You can subscribe to this podcast in order to hear more from us. Thank you for listening, everyone, and I hope you'll join us next time on the Fourth Trimester. The theme music on this podcast was created by Sean Trott. Hear more at soundcloud.com/Sean Trott. Special thanks to my true loves, my husband Ben, daughter Penelope, and baby girl Evelyn. Don't forget to share the Fourth Trimester Podcast with any new and expecting parents. I'm Sarah Trott. Goodbye for now.
Hello again, bicycle man. I know you're doing all that you can. I wrote the song, simple and true. I wrote the song, I'll sing a song for you. You got your wheels, you got your gears. You ride around town without any fear. You got your pedals, you got your brakes. You always wear your helmet for safety's sake. Hello again, bicycle man. I know you're doing all that you can. I wrote the song, simple and true. I wrote the song, I sing a song for you. Hello again, bicycle man. I know you're doing the best that you can. I wrote the song, simple and true. I wrote the song, I sing a song for you.